Monday, October 18th, 2021. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at an article entitled Increased Growth Factors Play a Role in Wound Healing Promoted by Noninvasive Oxygen-Ozone Therapy in Diabetic Patients with Foot Ulcers. It comes to us from China. It was accepted in May of 2014. So let's take a look at what they found. I'll start here in the abstract. It says the effective rate of ozone group was significantly higher than that of control group. The wound size reduction was significantly more in ozone group than in control group. After treatment, the expression of VEGF, TGF-B or beta and PDGF proteins at day 11 were significantly higher in ozone group than in control group. Ozone therapy promotes the wound healing of diabetic foot ulcers via potential induction of these different proteins and growth factors at early stage of the treatment. So let's take a look at what they did and what they found a little more in detail. So here's a little bit on the study design. It included patients that were randomized into two groups. After debridement, the ozone group received non-invasive oxygen-ozone treatments with 52 micrograms of ozone, total volume of 20 to 50 milliliters, in a special bag. So they were doing limb bagging for 30 minutes per day for 20 days. So 30 minutes a day for 20 days. So quite a bit of ozone therapy limb bagging treatments going on there at a decent, really a good dose, we would say, 52 micrograms or not dose, but concentration rather. You see some of the pre-treatment, post-treatment pictures here. So pretty significant. Now, the question is, though, how did ozone therapy do as opposed to just the standard treatment? The effective rate was significantly higher in ozone group than in the control group, 92 versus 64%. Oxygen ozone treatment increased the collagen contents of the wound. That's pretty cool. The different growth factors in wound exudates were upregulated by ozone therapy. That's really cool. We know that, but it's very important to see it. So you have different pre-treatment and post-treatment pictures here of the different collagen fibers in the different control groups and ozone groups. And here's charts that demonstrate just the efficacy of the ozone group as opposed to just the control group. So once we get into discussion, it says the ozone treatment. This is. I wanted to highlight that this is different studies that they showed had various effects with ozone therapy. And this one in particular, they used rectal insufflation at 50 micrograms per milliliter to improve glycemic control and prevent oxidative stress in rats. This is ozone treatment by rectal insufflation as well. Improve prothrombin time, reduce biomarkers of protein and lipid oxidation, increase total antioxidants. And there's a few others that are noted here just to go along with what they're showing and showing you that it is not a one and done study, but there's other studies that have been done that have results that compare, I guess, in different ways. Here, there was a pre-treatment group with ozone in the control group. You can see the collagen here and the different growth factors are similar in the pre-treatment group, so it didn't really have effect before they had the problem. But post-treatment, you see here the difference between these two, and the difference between these two is significant. Same here, showing that after the treatments, there were significant differences in how the tissues looked. It may be more important for the wound healing to stimulate the expressions of endogenous growth factors at local wound sites. So they're saying you can't just put growth factors in there and expect it to have the same result. Actually, having the endogenous stimulation of growth factors there at the site is more effective and more helpful. The results show that the efficacy of ozone treatment for the healing of diabetic foot ulcers may be partially due to the increasing of endogenous growth factors at the local wounds, which has not been reported before. So there you go. That is 5 minutes of proof, and we will see you next week with another installment.